My 6-year-old put a high schooler in the ICU, and the trauma doctor requested her for a case study. The call came from University Hospital at 9:30 p.m. on a Friday night. I was finishing dessert at a mandatory work dinner when my phone lit up with 3 successive calls from numbers I didn't recognize. The first voicemail was from a hospital administrator asking me to come immediately regarding my daughter Nora. The second was from a police officer named Detective Kyle Brennan, saying there'd been an incident at my home involving serious injury. The third was from my neighbor asking if everything was okay because she'd seen ambulances and police cars outside our house. I excused myself from the table, my hands already shaking as I tried calling my wife Julia, who was working the night shift at her hospital across town. She didn't answer. I tried our home phone. Nothing. I got in my car and drove 20 minutes to University Hospital with my heart hammering so hard I could feel it in my throat. My daughter Nora was 6 years old, first grade, tiny for her age. She still slept with 3 stuffed animals and asked me to check under her bed for monsters every night. Whatever incident involved her couldn't possibly be what the detective's tone suggested. The emergency room parking lot was half empty when I arrived. I ran inside and gave my name at reception. The woman's expression changed immediately from professional courtesy to something more complex. Concern mixed with wariness. She made a call, and within 2 minutes, Detective Brennan appeared. He was maybe 40, weathered face, tired eyes. He asked me to follow him to a private waiting room, and my stomach dropped because private waiting rooms meant serious conversations. We walked past the main ER into a family consultation area. Inside were 2 other people. A man and woman in their late 40s, both wearing business casual clothing that screamed upper-middle-class professionals. The woman had been crying. The man's jaw was clenched so tight I could see the muscles jumping. Detective Brennan introduced them as Gregory and Diane Thornton. Their 17-year-old son Blake was currently in surgery for severe head trauma, skull fracture, brain bleed, critical condition, and my 6-year-old daughter had put him there. I couldn't process the words. Couldn't make them fit together into meaning. Gregory Thornton spoke first. His voice was controlled, but vibrating with rage barely contained beneath professional courtesy. He informed me that my daughter had violently attacked his son with a weapon while Blake was babysitting at our house. Blake had been hired through a family friend's recommendation to watch Nora and her 3-year-old brother Finn while Julia worked her night shift and I attended my work dinner. Gregory explained that he and his wife were both attorneys. Corporate law. They knew their rights. They knew my daughter's actions constituted aggravated assault, possibly attempted murder given the severity of Blake's injuries. They would be pressing criminal charges despite